So in this video, we're going to review the cranial nerves. Now, cranial nerves are named because they come off the brain, and there's 12 pairs of them. They're associated with your brain. 10 of these 12 actually come from the brain stem, and the other two are associated with higher structures. So most of these cranial nerves are mixed, but there are some that are just purely sensory or motor. And there's different mnemonics we can give to help us remember the names of these cranial nerves. And remember, 1 through 12, and they're actually sort of numbered in Roman numerals. But they're named from rostral to caudal, right? So nose side to tail side, or anterior to posterior, you might say. And so our mnemonics to help us memorize the names of these nerves are, on occasion, our trusty truck acts funny, very good vehicle anyhow, where the first letter of each of these words correlates with the first letter of the name of the cranial nerve. One that I like better is, oh, once one takes the anatomy final, very good vacations are heavenly. And so looking at an inferior view of the brain here, what we see then are those cranial nerves, colored in yellow here. And remember, there's 12 pairs, so they're on either side, so you have right and left here. But if we work our way down, we can count them out and then name them. So you have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. And they're on both sides, right? So you can go down on this side as well. Now, cranial nerve number 1 is the olfactory bulb, or olfactory nerve rather. And then cranial nerve number 2 is optic. Number 3 is oculomotor. 4 is trochlear. 5 is trigeminal. 6 is abducens. 7 is facial. 8 is vestibulocochlear. 9 is glossopharyngeal. 10 is vagus. 11 is accessory. And then 12 is hypoglossal. So in the coming slides, what we'll do is we'll go through each cranial nerve and talk about the functions of those. So what we see here then is a nice little table that summarizes the names of our cranial nerves next to their function, whether they're sensory or motor, as well as whether they carry parasympathetic nerve information. So we can work our way through these as we go through the slides. So the first cranial nerve is number 1, and that's olfactory nerve. See, the olfactory nerves originate from the olfactory mucosa, the superior part of your nasal cavity. They cover the superior turbinate here, and the nerve is actually made of the axons that come from the olfactory sensory neurons. And they send their axons through the cribriform plate of the ethmoid bone, where they synapse with secondary sensory neurons in the olfactory bulb here. So technically, the first cranial nerve is all of these axons that are projecting from the olfactory mucosa. Now, the olfactory bulb and nerve carry sensory information from the nasal cavity of smell, which makes sense. Now, there are chemoreceptors on these olfactory cilia and the olfactory epithelium here that pick up chemical molecules that you inhale, either through your nasal cavity, through the nostril, or through the posterior part of the nasal cavity via the nasopharynx. And these chemicals actually bind to receptors, which trigger basically graded potentials that can trigger action potentials that they can send to your active olfactory bulb, which can help you process olfactory or odor information. Now, cranial nerve number 2 is the optic nerve, and we can see that they're basically made of axons that project from the posterior part of your eyeball, which is the retina here. So axons from the retina project back towards the brain through the optic nerves here, where they cross at something called the optic chiasm. Now, after the optic chiasm, then that optic information goes back towards the lateral geniculate nucleus of your thalamus, and then to other parts of the brain like the primary visual cortex of your occipital lobe. So this is also just sensory, and it's only going to carry information for vision back to your brain. Now, the third cranial nerve here is oculomotor nerve. Oculomotor originates from the midbrain, and it actually goes to 4 of the 6 extrinsic eye muscles. Now, this carries motor information to these muscles to help move your eyeball around, and it carries somatic motor nerve information to these eye muscles, but it also carries parasympathetic nervous system information to the pupillary muscle, as well as muscle that controls the shape of your lens, which is ciliary body, and it goes to the ciliary ganglia to help control this. Now, cranial nerve number 4 is called the trochlear nerve. And trochlear nerve actually goes to one extrinsic eye muscle called the superior oblique, It's named this because the superior oblique muscle actually goes through this little lever called the trochlear, and there's one cranial nerve that controls this one muscle. Again, it's only somatic motor and input to this one muscle of your eyeball. Now, cranial nerve number 5 is trigeminal, and there's actually 3 branches of this, hence the name tri. So we have the ophthalmic branch, also called V1, the maxillary branch, also called V2, and the mandibular branch, which is also V3. So these branches basically go to the skin of that respective part of the face. So the ophthalmic branch goes to the skin of your eye and sort of the forehead. The maxillary branch goes to the skin which is on the middle part of your face by your maxilla. And the mandibular branch goes to the skin of the mandible as well as chewing muscles. So if you look at the trigeminal nerve here, you can see those 3 branches. We have ophthalmic, maxillary, mandibular branches. So when you think trigeminal nerve, think about skin sensation from the face here. So you can see that these dermatomes correlate with the nerves that innervate these parts of the skin. So you have ophthalmic, maxillary, mandibular branches. But it's the mandibular branch, or V3, which also goes to some of the chewing muscles. Things like masseter and the pterygoid muscles are actually innervated by the mandibular branch of trigeminal. But trigeminal is mostly sensation from the face. Now, cranial nerve number 6 is called abducens, and abducens originates from the pons, actually kind of right at the juncture of the pons with the medulla oblongata. And this also goes to one extrinsic eye muscle. And in this case, it's actually lateral rectus muscle, hence the name abducens. Because lateral rectus muscle, when it contracts, actually abducts your eyeball, so it turns it laterally away from the midline, and it's abducens nerve that controls this. So its primary function is actually to control the lateral rectus muscle of your eyeball. So far there's already 3 different cranial nerves that go to these extrinsic eye muscles that move your eyeball around. Now, cranial nerve number 7 is the facial nerve. Facial nerve is both sensory and motor. Its motor function is to go to most of the facial muscles. So when we talk about muscles for facial expression, and it also transmits sensory impulses from your taste buds. So facial nerve is also involved with taste. So it innervates the anterior 2/3 of the tongue for taste. But it also transmits parasympathetic nervous system information to your lacrimal gland as well as your palatine glands and the submandibular, sublingual salivary glands as well. So these are involved with controlling saliva production. So if you look at facial nerve, it seems to follow a similar pathway as trigeminal nerve, but it's very different in terms of function. It's different because facial nerve is mostly involved with motor output to your facial muscles, whereas trigeminal nerve was mostly involved with sensory input from the skin of your face and the mucosa of your nasal and oral cavity. So facial nerve actually goes to a lot of muscles of facial expression, but it also carries sensory information from the anterior 2/3 of your tongue for taste, and it also carries parasympathetic motor output to the sublingual and submandibular salivary glands for saliva production. Now, cranial nerve number 8 is the vestibulocochlear nerve. It's mostly sensory with a little bit of motor, but its sensory function is what carries balance and hearing information from your inner ear, hence the name vestibulocochlear nerve. And so this is what helps inform your brain of your head's position as well as sound information. Now, the glossopharyngeal nerve, hence the name, goes to your tongue and your pharynx. So the glossopharyngeal nerves actually involved with taste, swallowing, saliva production, and sensory information from your carotid arteries. So it actually carries sensory info from the posterior 1/3 of the tongue for taste. It carries parasympathetic motor output to your parotid gland for saliva production. It goes to the muscles of your pharynx for swallowing. And it also carries sensory information from the carotid bodies for blood pressure and pH sensation back towards your brain. Now, the vagus nerve is one of the largest nerves of your body, and it's called vagus nerve because vagus comes from the Latin vaga, which means to travel or wander. So think of the vagus nerve as the wanderer. This is cranial nerve number 10. It actually goes down and innervates a lot of different things. It goes to some of the muscles for swallowing, so it correlates with glossopharyngeal nerve with that function. It actually goes to muscles of your larynx for talking. It also carries sensory info from your carotid arteries, again, for blood pressure and pH information. It also innervates most of your thoracic and digestive viscera to control the rest and digest functions of these organs. So your vagus nerve would actually slow down your heart rate. It would actually bronchoconstrict your airways and then increase digestive activities during rest and digest phase. Now, cranial nerve number 11 is the accessory nerve, and this one actually is only motor to the muscles of your superior back. So when you think about like your sternocleidomastoid, the scalenes, and the superior part of your trapezius, it's the accessory nerve that innervates these muscles. And what's interesting is that meningitis, which is inflammation of the meninges, can often present as tension within these muscles because of impingement on this nerve. You actually get tension within the superior back muscles. So one of the ways you can diagnose meningitis is to look at tension of the superior back muscles as an indicator of accessory nerve injury. Now, cranial nerve number 12 is also only motor. This one's called hypoglossal nerve, and it actually goes to only your tongue muscle here. So it's involved with talking and basically chewing because you need your tongue to move around and control the shape of the bolus of food for swallowing. So in order to memorize the functions of these cranial nerves, we actually have a mnemonic to tell us whether it's sensory, motor, or both. And our mnemonic here is some say marry money, but my brother believes it's bad business to marry money. Or you might say some say marry money, but my brother says be brave, make money. And so this actually helps us to memorize the sensory or motor or both function of these nerves. So remember, it goes some say, so sensory, and that makes sense because you have olfactory sensory, optic sensory, marry money, right? Oculomotor is motor, and then trochlear is also motor. But, and this is trigeminal, so both sensory and motor, makes sense because trigeminal is sensory of the face and motor for chewing muscles. So abducens is also just motor because it goes to the lateral rectus muscle of your eyeball. Brother says, right? So brother being facial, and facial is both sensory and motor because it goes to muscles of the face, but it's also involved with sensation from your tongue for taste. And then this one's only sensory because this is vestibulocochlear nerve, and that actually picks up sensory information from your vestibular and cochlear system, so balance and hearing. Then we have glossopharyngeal, vagus. Glossopharyngeal is both, and then vagus is also both. And then remember, we end up with make money. So accessory is motor, hypoglossal is motor. So accessory goes to the superior back muscles, hypoglossal nerve goes to your tongue muscle.